We're sitting here less than a year later. You were 97 pounds. You deadlifted 175 pounds. You had to do pull-ups, right?
Got the first clean one yesterday.
Lost
all my muscle mass. Couldn't walk when I left the hospital. Couldn't get out of bed. Couldn't walk upstairs. I had never been at a point in my life where I couldn't do something. That's when I say lived experience, to make the resolve to build a better body. Before I met you, I think I had already been diagnosed with cancer and had gone through chemotherapy and radiation therapy. I was still very in the technician kind of phase. I've seen this before, I'll be fine. The human body, human mind, human spirit is so resilient. I'm 64. I did my first pull-up at 64. I couldn't do one at 30. It has completely changed the way that I practice medicine. People will ask, what is the key to longevity, or what is the key to health and wellness? And I will always say, start with movement. Sadly, when I look online and I look at exercise for people my age, and they're talking about chair yoga. I mean, chair yoga is great, and chair yoga is a great starting point.
Right.
But for many of us, it shouldn't be the final point, right? It ain't over until it's over. Every day is a day that you can feel better, be healthier, no matter what your starting point is.
I am super excited about what we're working on, the solutions that we're going to be able to provide for so many people, and finally bridging the gap between the medical aspects, the fitness aspects, and what we're going to be able to do for women.
I'm so excited. That's what gets me to the gym every morning.
Dr. Poynor and I are conducting a formal research study, 12 weeks, medically supervised, and we're only taking 30 women.
Click the link below for the full details and how to apply.
Okay, well, here we are. This is exciting.
Totally.
A little bit different from what we usually do. I've been on Dr. Poynor's podcast, Decoding Women's Health. She's been on my podcast. And now we're doing something together because this next few series of podcasts we're going to do, I think is going to be very powerful and valuable. So if you don't know Dr. Poynor, you need to know Dr. Poynor. I'll let her explain who she is in her own words.
So I'm actually, I like to call myself a wayward GYN oncologist. I was a cancer surgeon for many years, now focusing really exclusively on midlife women's health and women's health in general, actually, but really on midlife women's health. And now really that intersection between fitness, muscle, and longevity, and overall women's health and well-being.
Right. Excellent. And you really are the expert of the experts' core. This is, I mean, you've given us your explanation of who you are, but there's so much more to what you do.
You
had your own
years
very
behind
successful practice in New York. You've been doing this for over 30 years. You were in the operating room, is that correct?
I started out as a cancer surgeon. I was a cancer surgeon up until very recently, up until 2024, when I left and went exclusively into women's health, and just to kind of help to further the field, I hope. Okay.
Well, you are definitely furthering the field. And I realize that some of your audience might not know who I am. I'm Robert Brace, wellness expert, owner of Brace Life Studios. And we've been working together, training together, collaborating. And so, like I said, I think this is going to be super important to a lot of people. And we're going to do a series, but I think the thing about this series really is it's really anchored in your personal story, which makes, I think, it even more powerful, right?
It's certainly a lived experience. And I think anytime you have a lived experience, it just, it really amplifies, I think, the foundation behind recommendations and why we would recommend something and how we would recommend it. So, and understanding that habits are important and that everything is imperfect and you have to try and retry. And going through that lived experience, I think, is really important.
Absolutely. And, one of the interesting things for me is that we've been training for about just under a year.
Yep.
And just recently I found out that there's a lot about your story that I did not know. Like when you walked in those doors to Brace Life Studios, you were about 2 weeks out of hospital.
Right.
You were about 97 pounds.
Yeah.
I remember you explaining how it was difficult for you. At one point you had to crawl to walk into your bed because you were just recovering from potentially life-threatening illness and surgery, right? And so I want you to tell that story because for me, in the beginning, there are two distinct images I have from you. We were introduced by Francis Turner.
Right.
You did an incredible event at our studio on women's health and menopause. We had so many questions after it. And so I'm seeing you in your element, in a powerful position, right?
Yeah.
And then the next time I see you, you walk in the studio, I don't know what had happened.
Yeah, you were shocked.
I saw that you had lost a lot of weight. I saw that something was off, but I didn't know what it was.
Yeah.
And so can you take us through that journey of between the first time I saw you and the woman who was sitting there when you came back?
Yeah. So the first time I came into your studio, I was invited to give a talk by Francis. And I knew there was something special there. I couldn't figure out what it was, but the vibe there was great. The energy was great. And I'm a big believer about the energy when you walk into a room. And your energy was great. So you were kind of locked in the back of my mind.
Okay.
And but I was still at that time, drinking a bourbon to go to sleep and drinking a pot of coffee to wake up and sleeping 3 hours a night and just living on fumes, working, living my best professional life possible, running a super busy practice, operating all the time, seeing tons of patients, and I hope helping women. I mean, I think we were doing a good job. I hope we were. And but then life changed. Before I met you, I think I had already been diagnosed with cancer and had gone through chemotherapy and radiation therapy, but I had found it early myself. It was a little cancer, cancer 101, cancer light, but treated with chemotherapy and radiation therapy, but was a little bit of a wake-up call, like, ooh, you better take care of your body or you're going to have a problem. And so that kind of lasted for a couple of months. I took care of myself for a couple of months, but by the time I was back to my kind of crazy life of like no sleep and just, basically living on fumes that we all talk about.
Right.
And then fast forward into a year ago, really a year and a couple months ago, April of 2025. And my mother was diagnosed with pancreatic cancer, unfortunately. And I was just looking at her, we call cell-free DNA, so one of her laboratory reports. And I was like, she's BRCA positive. And I had sent off...
And what does that mean?
So that means there's a genetic risk for really breast cancer is the main one that we think of when you have a BRCA1 or BRCA2 mutation, up to a 90% chance of developing breast cancer, but also a significant chance of developing ovarian cancer, up to 50 or 60% with a BRCA1 mutation, which we have in our family, or pancreatic cancer, which is much less frequent, much less common, but we have 2 pancreas cancers in our family. And my mom was diagnosed with pancreas cancer in last April, basically. Last April. And so did my genetics were found to be positive. So the first thing I did when I found out that my genetics were positive, while my mom was getting chemotherapy, I booked myself for surgery to have my uterus and fallopian tubes and ovaries removed to decrease my risk of developing ovarian cancer because for people who don't know, ovarian cancer is really hard to screen for. It's very difficult to screen for. So really, when you're at high risk for ovarian cancer, the way to prevent it is to take out the tubes and ovaries.
Wow. And now this was a direct response to finding out that you had this gene.
Correct. Correct. So this is an area that I specialize in. I actually have a PhD in molecular genetics.
Wow.
So this is like my home turf,
right.
So
let me ask you this then, because this is your home turf. This is this is what your degree is. But what is it like emotionally? Because you've probably seen these tests before, advised other people to do them, right?
Yeah.
But when it's you and you are the person on the other side of this, how does that affect you emotionally?
I have to say, I did not become a patient until I had a problem afterwards that I'll go over. But during this time where I found out that I was BRCA positive, I was still very in the technician kind of phase. I was like, I've seen this before. I'll be fine. I'm just going to take out my tubes and ovaries. I'll go ahead. I'll do a prophylactic mastectomy down the line a little bit. I'll get my screening done for breast cancer, but I'm going to take my tubes and ovaries out first. It'll be fine. I'll be back at work in a couple of days. No worries. It's all going to be good. I'm taking care of my mother. mother, so it's really kind of 1, 2, 3, this is what I'm going to do. And so it didn't really register, to be honest with you, as
because
being
for
something.
Most people that,
Yeah.
even the way you're talking about it, I'm going to get my fallopian tubes removed. I'm going to, very procedural.
Yeah.
Right. So is that just you? Is that the medical expertise giving you a sense of calm?
I think it's a combination, but I always say that I have a sense of calm. And I did this when I had cancer too, when I was diagnosed with cancer. It wasn't, I think I didn't lose any sleep over it. I just kind of did 1, 2, 3, here's my treatments, here's what I need to do. And I don't think I missed a day of work during that treatment at all, actually. And, but I always say that I have the ability, I had a practice full of cancer survivors.
Okay.
So I had probably 3/4 of the patients, or maybe at least 50 to 75% of the patients in my practice, my former practice, had survived cancers. So I knew that you do your treatment, you take a time out, and then you move forward, and you're going to have a life afterwards. Because I had a whole patient population, a whole group of women I was taking care of who had a life afterwards. Like, not everybody's so fortunate, obviously, but I had that ability to see the time past that diagnosis.
Right.
So the same thing with being diagnosed with this genetic predisposition, right? I knew that I had a whole practice full of people who took out their tubes and ovaries, either screened their breast or did mastectomies, and who were fine, basically, because that's what I did. I mean, I was a molecular geneticist and took care of people who had these mutations that I was diagnosed with.
Right.
So I was still very much in the technician phase, like being my own technician. I think I even booked my surgery with my friend who did my surgery. I didn't even tell him. I just booked it with the secretary. I said, just put me on his OR calendar. This is what I need to have done. And and then I had another surgeon who did some reconstructive work at the same time. So I just booked everybody with their secretaries and didn't even talk to them until like 2 days before surgery. I was like, this is what I did, guys. Like, just take care of it. So at that time, I was very much in the technician phase still. And then I had the surgery, and of course I'm a physician having surgery, and then the complications start. But the complications really started because of the previous therapy that I'd had for radiation therapy. I always like to say that I'm a walking textbook of GYN oncology, right? I had an HPV related cancer. I had chemo radiation therapy for it. I would say I left GYN oncology, but it never left me. I lived GYN oncology on a daily basis. So because of that radiation therapy, what happens is you don't heal the same way after surgery, and you're more prone to get what we call adhesive disease or scarring after surgery. So anytime you open the abdomen, you're at risk of getting scar tissue. And that scar tissue can lock up your bowel and cause bowel obstructions. Right. And that's what happened to me. And so I had an appendectomy at the same time in my surgery. I had a fairly aggressive surgery for the oophorectomy and the hysterectomy and such. And a piece of bowel just got stuck. And that can be very significant. So I had what's called a complete bowel obstruction after surgery, which I had managed thousands, hundreds of bowel obstructions after surgery, because unfortunately with ovarian cancer, you get bowel obstructions, or you do big surgeries and you get bowel obstructions. So I also knew this. I knew that this was going to be okay too, until I didn't.
Until you didn't.
Until I didn't. Until I was really sick.
Okay.
And got very, very ill, and had a nasogastric tube in that, of course, being the good patient that I am, kept pulling it out.
So from your nose into your stomach.
Had put in hundreds of nasogastric tubes in my career, and I tell everybody, until you've had a nasogastric tube, you really don't understand what it is, because it actually is very uncomfortable. It hurts. You're tethered to a wall in this narcotic haze, is what I remember, just looking out over the East River. And I was, at NYU, and they were taking great care of me. I was in a beautiful room overlooking the East River with the helicopters flying back and forth, but, tethered to a wall with a tube in my nose, watching the helicopters with narcotics on board. It's a very it's an experience that's almost terrifying, because you're like you're in the clouds, you're seeing these things fly around, and you're going, when am I ever going to get out of this haze and fog that I'm in? And so it's not like you're left to your own mind. I mean, you're seeing things because of where you are in the room. And got very sick, but eventually recovered, of course, and was in the hospital for a couple of weeks, sick for a couple of weeks. But eventually recovered because I had really great care. I had a super experienced surgeon who's a friend of mine taking care of me. So I totally trusted her to, not go back to the operating room to watch with this tube in, that type of thing. But I got sick. I had no nutrition for a long time, and
no nutrition.
Lost all my muscle mass. And I think we're going to talk about muscle mass and the importance of muscle, but lost all of that.
Right.
And couldn't walk when I left the hospital, couldn't get out of bed, couldn't walk upstairs, was crawling around. I'd get out of bed and I would literally walk to the door and have to sit down at the door. And that's when things got really, really scary, actually, when I got sick in the hospital, and then when I was at home too, it was even scarier, because it was like, wow, I can't do things when I'm out of the hospital. And I had never been at a point in my life where I couldn't do something. And that's when I say lived experience to make the resolve to build a better body. Basically, I'd taken my body for granted, like it's always going to work because I'm Elizabeth Poynor. My body's always going to work, know. And then it didn't. And then I realized that, okay, you really have to take care of yourself, and you have to pay attention to these things. And I also never realized the importance of muscle till I didn't have any. And not being able to move, not having mobility. And that's when, about a couple weeks after that, I was like, okay, I have to do something. And I remembered this magic person in this magic place on Mulberry Street, and was like, I'm going to go down there and I'm going to get myself back in shape. Because when I gave a talk at your studio, you had the pictures from the Brace Life book of all the beautiful, strong women that you had trained. And I was like, I need to build muscle. I know who can help me build muscle and build my life back together.
Wow.
And I walked back into your studio.
And
that's how I walked back in. I probably crawled up that flight of stairs that you have to get up.
I could still see the strength, but I knew something had happened, and I did not. I did not know at that point.
Yeah.
So.
Yeah. I had. It was very bad. But again, not understanding the importance of really taking care of your body. So now, when I make a recommendation to somebody, it's a lived experience in terms of, I'm going to recommend to you what I've done to help myself get better with you.
Right. Right.
And so I only make recommendations that I would only make to myself in terms of building a better body. And but also that health is not passive. Health is active. Health is an active endeavor. It's just like I always give the analogy of the car. If you leave a car out in nature, it's going to rust. It's going to have problems. But if you take care of it and put it in the garage, change the oil, it's going to live forever. Yeah, I hope.
Excellent. All right. So what I want to do, because this is your lived experience, as you've said. And so it's been in your body, it's been on your journey, right? But I think people really need to understand, like from my perspective, seeing you walk in as you did that day, and now we're sitting here less than a year later, right? Yeah. You were, like I keep saying, 97 pounds, you were very thin, and at this point today, you are doing dumbbell biceps with 20, sometimes 20 plus pounds, which is the heaviest that any woman lifts in the studio. You are doing dumbbell rows with 50 pounds now. And you've asked me to get heavier weights. And you're getting
heavier weights. I know, and you ordered them. More heavier dumbbells.
And you've asked me to order heavier weights for my studio, right? You deadlifted 175 pounds, which is over your body weight. And I got a text from you the other day. We're going for, 220 now?
220 is the goal.
With the team and with Oscar. And you've done, you were doing chin-ups, but that wasn't enough. You had to do pull-ups, right?
Got the first clean one
you
yesterday.
got your first clean pull-up
Chest
yesterday.
out, chest was up.
Chest out, very clean, right? Now, yes, we're talking about these things, but that is remarkable. It is not that we've done extreme things, because I don't want to give the impression that we've done.
No, it's been slow. It's been slow and steady.
Slow and steady, but that transformation is incredible, and it's partly what we do. We're going to work together to give to other people, and we're going to study it. But do you take time to really let that land? Less than a year ago, where you were to where you are right now, how does that feel embodied?
Yeah, I think it's powerful, obviously. And I think I always kind of laugh a little bit when I'm at the studio, like, my body's a science project, right?
Right.
But it kind of is, in terms of just the ability and resilience. And, the human body, human mind, human spirit is so resilient. And if we treat it and train it the right way, the sky's the limit. And I'm going to just state my age. I'm 64. I did my first pull-up at 64. I couldn't do one at 30. I couldn't do one at 20. I'm sure I couldn't do one when I was swimming, when I was 18. But I think it just shows you that with the proper training, and that really needs to be said, because, I show up at that gym 5 days a week. I'd be there 6 or 7 if you would let me. I don't know that you have a 6-day package. I don't think you have a 7-day package. But also that's a testament to the training itself, obviously, because you can walk into and any gym and kind of go in and not train the right way, or not be with the right person who understands the working of the human body, and not make progress. So I think it's two things. I think it's, obviously mental fortitude and walking in every day that you'll allow me to. But also the
I don't want to give the impression we're not allowing you. We can make concessions for you, for sure.
But I also think I think about it. When I think about it a little introspectively, I think about the magic of the proper training also. I think the combination of mindset with the proper training, because you can walk in with a great mindset and hurt yourself.
Yes.
And this is what my husband every day is like, don't hurt yourself, don't hurt yourself. And I'm like, don't worry, we have this all under control, because now we're going into heavier, significant weights. So I think also, part of this, when I think about it, is that if you do things the right way, the sky is the limit with the body, the mind, the spirit.
Absolutely.
So it's extremely powerful when I sit and think about when I sit with my thoughts for a little bit.
And then for me, on the outside, watching this, it's like watching the lights turn on, because I think there was a point where you began to get stronger, and I think even surprised yourself a little bit. But then there's something about having a medical mind, the curiosity with that medical mind, and starting to put the pieces together of how, there's medicine in the muscle, and and watching you, like you said, treat your body like a science project. One, has been an education for me, but two, I think it's a very unique perspective that not many people are going to have, because I've heard doctors, been on panels, doctors giving advice to work out, move, exercise, right? But it's not their lived experience, and it's not their lived experience with the intensity that it has been for you. So how do you feel that curiosity has been shaping how you see medicine, how you see working out, and the nexus between the two?
Yeah, I think it's huge. And sometimes I actually get a little terrified when I think that I didn't have this knowledge base beforehand, right? I'm a well-educated physician, excellent training, super curious, reading all the time. But this knowledge base, I didn't have it until I started working in it. So it has completely changed the way that I practice medicine and focus on health and longevity for women, actually, because, we get where, we're going to check these tests, we're going to do this, check your cholesterol, and then we're going to treat your cholesterol, we're going to treat your elevated glucose, that type of thing. But I will tell you that you can treat all of that, but unless you have muscle mass and you are in good aerobic shape, I mean, I had to do my aerobics today.
Yes.
I had to do my cardio today, which I don't like, but I have to do it. But it really is the foundation. And so people will ask, what is the key to longevity, or what is the key to health and wellness? And I will always say, start with movement. And that is the one focus and shift that has really shifted for me, because I used to say, check this, check that, screen for this, do that, is start with movement. And then do all the routine preventive things, but move your body, just get up and move, because it's going to help your brain health, it's going to help your cardiometabolic health, your bone health, your mental health. And sometimes women will say, I just want a program, just lay out a program for me. What do I need to do to get healthy and be healthy? And I'm like, start with movement. Let's just start with movement. Are you working out? Are you lifting weights? Are you doing cardio? We start with movement. That's what we start talking about.
Right.
How are you feeling? Could you feel better? And are you moving? Is kind of where we start when we start putting together programs for women. And so I think that one thing that has really shaped and changed the way that I practice medicine and promote health and wellness in women is the entrance and the gateway to all of this is movement. And sleep is important, nutrition is important, but if you move more, you'll sleep better.
Right.
If you move more, you want to have better nutrition.
Right.
So it's like the entry point into not only shaping our physiologic systems in terms of brain health, cardiometabolic health, bone health, mental health. I can go through the list again.
And so,
but also just getting there.
But even with that, I think that's important to hear from you, because you're talking about movement and brain health. You're talking about movement. Like, what does that actually mean for the average person practically?
It means that the lifestyle that we have in our country right now, where many of us aren't moving, and this is what I get to, when I sit with my thoughts, I'm like, oh my gosh, I thought I was moving because I was running around my office, but I wasn't really moving, right? And I think that we know so many benefits of movement and exercise and muscle to all of these systems that it worries me that we don't talk about it more and that we don't focus on it a little bit more, because we know we have great data in terms of the Lancet data, which is a obviously extremely well-respected publication, about almost 50% of dementia is preventable, and movement and exercise is a big component of that, just starting with dementia. And so people don't always equate it with brain health. So again, it's really, that has really altered and changed and has become a focus.
Now, you said you're in your 60s, had a great career, you've helped a lot of people heal, you're lifting lots of weight, and you talk about it's helped your confidence. Now, you're accomplished. I listed all those things to say you're accomplished. It's not like you're somebody who's not confident, right?
Yeah.
So how has this improved your mental health, improved what we can refer to as the spirit, the emotional health? How has that process changed you?
So I think that I was always a person, surgeon in control, but also reactive, because I'm trained to be reactive, right? I'm trained to be, I have to react to this illness. I have to react to this bleeding in the operating room. I have to be reactive. And many times I have to be really quickly reactive, because if I'm not, you don't have time to sit around and think about things. And so I think that the one thing in terms of movement, strength training, and exercise has made me less reactive. I'm able to control my inner thoughts, control my mind, and take a step back, right? And become maybe more empathetic to a situation, to people in a situation, less reactive, like thinking like 10 steps down before I open my mouth. That's really changed, and that's control of the mind, right? That comes from better that comes from confidence, like, walking in and not being able to lift up the hex bar and then now lifting, so there's a sense of confidence that you get. But we also know that exercise and strength training in particular actually changes our neurotransmitters. I mean, it changes our dopamine, which is the feel-good hormone. It changes our serotonin. It changes the GABA pathways. And I always say, it was funny because I'm sleepy, I'm tired when I wake up in the morning, but I know that when I go into the gym in about 5 minutes, when the blood starts pumping in the gym, I'm going to feel good. And when I walk out of the gym, I can tackle my day, actually.
Right.
And I don't say gym, I say studio. But I know that that habit of doing that, I'm going to feel so much better, and I'm going to be able to better focus. We know that you have better focus when you work out and move. We know that your neurotransmitters for the feel-good transmitters change. We have great data with mental health and exercise, right? I mean, exercise and nutrition perform just as well as SSRIs for some people, right? Maybe even better. I think for me, even better, actually.
And what's SSRI? Just
so the serotonin,
right?
Yeah. So the medications that impact serotonin. So they give you more serotonin. So, one thing that I didn't mention to you is I tend to be a little depressive, right? I can definitely be like at perimenopause. I had a major depression. I've lived through everything. I'm the perfect person to be a doctor. I've gone through it all. But I think that mental health mindset, just feeling better about life and feeling better about yourself are so impactful. But we know the pathways that are involved in that now. And, one thing that I didn't mention, we didn't talk about, is actually cancer prevention. And for me, and specifically, I still haven't had mastectomy, so I haven't this elevated risk of developing breast cancer. I have a small risk of recurrence of my HPV-related cancer coming back. It's tiny, but it's small. So, I also focus on exercise and movement and the immune system, because we know that it impacts the immune system for the better. We know that for people who exercise and have good nutrition, that actually can lead to lower risk of recurrences of particular cancers that we have data for, and I'm sure it's going to extend through other cancers. So, again, super important also.
Yeah, and that's all. It's don't want to say great, but it's a different perspective because you have that lived experience, right? Now, one of my pet peeves, a lot of women over the years I've been training.
Oh, I know what you're going to ask. Yeah.
Will say, I don't want to lift weights because I don't want to get bulky.
Yeah.
Now, you are not bulky.
Yeah. I want to be bulkier. I want to be bigger.
You're not helping my case here.
Get big. That's Stacey Sims. Get big. Fill up the room.
But letting women know that they can still wear the fashion that you wear, that they're not going to get bulky. They're still going to look elegant if you do it in the right way. Look elegant, aligned, graceful.
Right.
What do you say to those women who maybe that is a stumbling block for them?
I think that you can get toned, right? You can develop muscle mass and not have a lot of hypertrophy, right? And it's also about proportion, right? So you don't want to, you want to make sure that when you train, that you train your muscles so that your body stays in proportion. Also, if aesthetics are something that's important to you, which they are important to me. And, but I also think that, we have this culture of, and we're shifting away from it, I feel, but we have this culture of everybody wanting to be a size 0 or a size 00, where we've gone from small to extra small now to extra, extra small. And it's kind of like, why do you want to be a 00? Why do you want to be an extra, extra small, you know? And so that, I think that kind of the social aesthetic is actually beginning to change a little bit. And I think that that's beginning to change a little bit. But I think that the most beautiful thing in the world is health and wellness. It's just health and being healthy. And so if you put on a little muscle mass while being healthy, that's a good thing, because frailty leads to earlier death. And there's something that we call sarcopenia, which is where you lose muscle mass. And you can be a size 00 and you can still have a lot of visceral fat and no muscle and be very unhealthy, actually. And that lack of muscle is not a healthy situation. So I think that if we begin to, to associate health and wellness also with beauty, perceived, and everybody has their own perceptions of beauty. And for my perception is to be healthy and to live a great life is beautiful, and we all are different sizes. I'm glad that we're moving away from BMI or just weight.
Thank you.
And so I think that looking at body composition is going to be a key forward in terms of helping women to build muscle. But you don't have to get bulky. I mean, I'm trying to get bulky, but I'm working really hard at it, and I'm not so bulky.
Right.
And but definitely you can train and tone the right way to meet your aesthetic and your own individual aesthetic. And if you're trained properly, if you train properly, you can do that actually. So you don't have to get bulky. And you have to actually overeat to get bulky too, right? So I'm eating 600 calories more a day so I can gain bulk in my muscles, right? So you have to really eat a lot to get bulky too.
Right.
So you can get strong, have endurance, be strong, and not be bulky also.
And even still, I know you're looking to put on more lean muscle mass, which you have incredibly, but you still have that lean athletic look.
Yeah, I mean, I have. Everybody knows I wear the same dress every day. I have the same dress in like a bunch of different colors, and I have the same color. I don't wear the same dress every day. I have them in multiple, multiples of them.
Yes.
Multiples of them. Some of them have yogurt on them. Some of them don't. But I also use that as a gauge because I know the way the dress that I like, and I want to be able to fit into it, so I can make sure that my waist fits into that dress as build my glutes and my hamstrings and my quads, and I build my shoulders, right? So there are ways to do this, and you know what? It's not so complicated because somebody listening to this goes, "Oh, that's so complicated." It's actually not. It's like the muscle groups are pretty straightforward, and how you train them is straightforward. Getting to the gym every day and getting with the right trainer or getting the right program is not always so straightforward. But the muscle groups are how to do it is pretty straightforward, I think.
Now,
did I answer that the right way?
Oh, absolutely.
Okay.
Your way is the right way.
Yeah, because
whatever.
I should ask you actually. So, what do you do when people come into the gym and say, "I don't want to be bulky"?
Well,
I mean, walking into your studio, but I want to be bulky.
Right. I repeat what you basically said, that you have to be genetically predisposed to getting that big, and for most women, especially on the menopause spectrum, that's not you, and you'd have to be very intentional about how much you eat and how much weight you're putting on, and then if you are lifting weights with the right alignment, with the right aesthetic. Remember, my background is I was a trained ballet dancer.
That's really important.
So if you're lifting with the right alignment, posture, aesthetic, then you can gain strength, lean muscle mass without, that bulky look, right?
Yeah, and you're the one who taught me how to use my back actually and open up, like chest up, right?
Right.
It's like how to use the back and how to always be in alignment.
Right.
And I think that part of how you train in your background is so key, and people don't talk about that because they go into the gym, to use your words, throw around weights, right, or they use a machine, that type of thing. But unless you put it together the right way with the right posture, I think so it's beautiful. People coming out of your gym are healthy, beautiful.
Oh, thank you. And even what you're saying, the back, how to use your back, how to control ribs, how to engage core, all of that, right? And if you have that approach, yes, you can lift weights and not get bulky. Now for you, you could have healed, lift weights, look great in all of your dresses, right? And not turned outward. But this has become kind of a mission for you, which you really have inspired me in terms of, where this is going, how we are now studying this so that we're not just, it's not a product, it is a studied methodology. Talk to me about why that's important to you and that perspective on something like what we are working on together, which, the whole reason we're doing it is to have my industry quite fairly can be criticized for a lot of overblown claims, things that are not substantiated, right? I'm talking about the fitness industry. And so it's great. It's interesting to me to hear why this is so important to you and what we're doing and how we're approaching and how it's become a mission for you.
So the mission, I think, is really kind of obvious, right? Because it's changed my life. It's changed. I think I know I've added years onto my life, because had I been living and going in that direction, I would have had an earlier death. I'm fairly certain.
And I'm so sorry to pause you here. Your biological age.
I haven't done my biologic
You haven't?
age yet.
Oh, okay.
No, but I will.
That. Okay, go ahead.
Haven't done it yet. But I think that, I tend to focus, and my curiosity tends to go where we don't have answers, right? And in medicine, we just say, go move, go get some exercise, right? But what does that mean? Like, what kind of exercise? When do I exercise? How do I exercise? What do I do? So we're at a time in medicine where we now understand that this is all beneficial, and we're understanding the molecular pathways which are behind it, which I find so fascinating, being a science and researcher at heart. But how we do it and how we advise on it and how we study it is just in its infancy. It's a field that's in its infancy. So I think when we know that something that's so important, that performs in some situations just as well as a medication that we're prescribing, if we're prescribing to you Celexa or any type of SSRI or any type of antidepressant, that type of thing, or we're prescribing to you metformin or something to control your glucose, but we know that getting out and moving is going to be helpful to you on every level, right? Not just your mental health level, but your cardiac level and the rest of your systems, right? But we don't know how to prescribe it, then we don't know what we're doing, right? So it's an area that you need to understand the science, to understand what to prescribe for what indication, and now we're moving into the realm of now making exercise prescriptions, right? So as physicians, we're not trained in that. We're not trained in it at all. I mean, zero. The only training I had in kind of the fitness aspect or movement aspect was like anatomy lessons, right? And now I'd like to go back and do those, because now I really understand the musculature. But we're not trained in nutrition, but we have like maybe a 2-week course in nutrition, a tiny book. But in movement, we have absolutely zero. So here's something that's so impactful to human life, human longevity, human wellness, human well-being, resilience, spirituality, and we don't even know what we're doing with it as physicians. And so that's why it's become a passion of mine to understand, how does this work? Especially for midlife women, and how do we prescribe? What do we prescribe? How do we get you to the gym? How do we get you to your studio, right? This is why I love sending people to you, because I know they're going to have like this great experience. But if I send them to like a person, a random spot that I don't know how they're going to train them, they could get hurt. They might not have effective training. So I need to understand that. I need to understand what I'm recommending and how I'm recommending it. And that's where you and I intersect, because it's the great divide between fitness and then the medical world, and they need to be brought together into one space, actually, and that's a space I hope that we help to develop.
Absolutely. And the thing that's incredible to me is that you're all in these spaces, but you're not seeing this crossover between medical and fitness, right?
No.
Why do you think that is?
We don't know the language. Physicians don't know the language. Unless you understand the anatomy, unless you understand how the muscles work. Like, I didn't really understand that my glutes were attached to my back. Like, my lower lumbar region was, impacted by my glutes, right? I mean, I didn't know that, right? I wouldn't know to really speak. I mean, PTs might know that, right? But not everybody's going to go to a PT, and they're looking to their physician to like give them that foundational view to say, okay, this is where you start, right? So we don't know that language. We're not taught that language. We don't understand that language unless we're going to PT school from, and so that I think that that's where the disconnect occurs, because we're just now understanding in the medical world that movement is important, right? The studies are just now coming out that, okay, movement is great for brain health. Muscle is the organ of metabolism, right? And we understand that, midlife women, which we haven't even talked about, have like a larger challenge because they're fighting against what we call anabolic resistance, right? So, but you have to understand all of this, right?
What's anabolic resistance?
So anabolic resistance is where it becomes hard to build up muscle, right? It's like we can't, so anabolic states are where you're building as opposed to catabolic states where you're breaking down, right? So if left to our own devices, we're actually breaking muscle down as we age unless we're actively trying to build it up. And in midlife women, that's even more significant.
Right.
And we know it works. We know we can build muscle. But I think that language, we just don't even know where to start as physicians, many of us. I think that, people who are training, actively bodybuilding, actively in the fitness world, right, they'll understand that conversation. I know there's a number of doctors who are in that world, but again, that's just not been part of our curriculum and part of what we've spoken about. And it also comes back to, we're now focusing on prevention, I hope now too, but you can look at this as treatment or, going along with treatments of actually illnesses and diseases. And I will say which is very interesting, because the reason I actually started working out originally, because when I came to you, I had been working out at the foot of my bed beforehand. But when I had chemotherapy, I knew that exercise helped battle chemotherapy fatigue. And that's actually when I started doing push-ups at the bottom of my bed and lifting some weights, back in 2021, because I knew that if I moved, that my fatigue would be less with the chemotherapy. But I only knew that because I was an oncologist, and some oncologists will speak about it. I think more do now. But that's when I started actually moving and putting that connection between fitness, movement, and medicine together, actually, and thinking about it.
Got you.
Because I couldn't miss a day of work.
Right.
I had to work out to get to work.
Yeah. And so that's, to me, what's very exciting is how we're beginning to look at, through this work we're doing, exercise as a real intervention and having the medical backing or at least research behind it, right?
Yeah.
Because it's one thing to have an incredible story. It's one thing to have the anecdotal data, but to have to bridge that gap between the medical and fitness in a way that people can receive, I think is really going to change things, especially for women in midlife.
Yeah. And I think, and defining the proper ways to train, right? You can, I'm a big podcast listener. I'm a social media listener. I read medical journals. I'm all over anything that I can get my hands on to understand. But you'll read 5 different ways to approach an issue. Like, oh, you need this zone 2. No zone 2. You need more zone 3, you know? And so we really need that data on, what impacts your body scientifically, like looking at outcomes of particular programs, looking at outcomes in specific populations, and developing those protocols, which you're doing.
Right. With you. Excellent. So a couple of final questions. What would you want to exist 5 years from now for women in midlife health, as it relates to what we're talking about, the nexus between medicine and strength training? What would you want to exist for women?
I would love women to have a platform, either whether it's in their physician's office or whether it's online or with the training programs, of a program, a recommendation, a fitness prescription for them. Here's what is effective. Here is how to implement it, and here is how to assess whether it's working for you. And that is outcomes driven. So I think that I would love for women to have an outcomes driven program that has good evidence, good data behind it. That says, okay, this is what we would recommend, and this is how it works for you. And I think if we could provide that to women, that would be really great. And we need to get that data about what the right things are.
Excellent. And one thing you told me was that of all of the issues that affect, I think it's midlife women or women in general, when you look at medical billing, which means if it's got a medical code, it means it can be treated. Correct?
Right.
I think you said something like 70% of those conditions do not have a code.
They don't have a code. Yeah, they're not.
What does that mean?
That just means women's health has been ignored, and we have, we have not looked at women's health through a gender specific. Well, and I can't always use gender, but we haven't looked at it through a hormonal specific lens, and how women differ physiologically from men. So if it's not defined in a population as a whole, or not defined in a male population, it's not going to be necessarily defined in that female population. And that female actually refers to two X chromosomes, right? So that just it shows you that we just don't know a lot about women's health in depth in a broad kind of manner. I mean, I hope that our women's health specialists know this, right? And and many of us are out there trying to change policy, trying to change how women's health is viewed. But I think it just is representative and demonstrative that women's health has just been kind of ignored. And pain, for example, endometriosis is one. Pelvic pain. Oh, just get over it. It's normal. Everybody has pain. Yeah, no, it's not normal to be debilitated 2 days a month or be debilitated from pelvic pain. We need a code. We do have a pelvic pain code. This is a poor example of that, but meaning that we have normalized so much of what goes on in women and normalized it and haven't given it always the proper attention that it needs.
Final question, because you're doing your first pull-up at 64.
Clean pull-up.
Okay.
Clean pull-up. Chest out.
Clean pull-up.
Wasn't a bad one.
Chest
Wasn't
out.
a crappy one.
You're like, perfect form, textbook picture, all of that. It needs to be said on record.
Oscar may disagree with that, but that's what I'm pitching.
Oh, well, we'll be there.
That's what I'm pitching.
We'll both take notes and we'll compare notes. But there are a lot of women who 40s, 50s, 60s believe that their strongest, most connected to their bodies, embodied years are behind them. And that what you've been through, I mean, look, you came in 2 weeks out of hospital, 97 pounds, was crawling into bed, and a year later, you're knocking out these incredible numbers, right? So, and some people can think, well, it's just for her because she's incredible or whatever. Like, what do you say to the women who are listening to this about what is possible from this point on in their lives?
It ain't over until it's over. Every day is a day that you can feel better, be healthier, no matter what your starting point is. We all have different starting points, right? I'm starting from these really crappy genetics and some significant hits illness-wise. But every day you can be better, actually, and your body can be better, and we know the pathways for that. You can help to make your mitochondria healthier, so you'll feel better when which are the energy powerhouses of the cells. So I say you can always, it's really, you can be strong at any age. It's just a matter of how you get there. It requires the appropriate training of the body to be strong, but everybody can be strong, because I could have given up a million times and said that's it, and refused to. But I think that we also need more people who are older who are speaking about this, because when I look online, actually, and I look at exercise for people my age, I'm looking at geriatric population, right? And they're talking about chair yoga. I mean, chair yoga is great, and chair yoga is a great starting point.
Right.
But for many of us, it shouldn't be the final point, right? And there's this great study that they've shown that even people who are in nursing homes, that you can give them weights and lift, and they'll actually build muscle.
Right.
So you can always build muscle. You can always feel better. It's just a matter of getting started and getting started in the right direction. And that's what I hope that we can provide and help to provide. how do we get people motivated to start, but also get them going in the right direction? Because I think a lot of people get discouraged because, they don't make progress or they get hurt and that type of thing. So going in the right direction is really important.
Okay. Well, Dr. Poynor, this is amazing. I am super excited about what we're working on and the solutions that we're going to be able to provide for so many people, and finally bridging the gap between, the medical aspects, the fitness aspects, and what we're going to be able to do for women.
I'm so excited. That keeps me going every morning. That's what gets me to the gym every morning.
So for those of you listening, this is the first in a series, and we're actually going to look at different aspects of what we're working on in terms of longevity, bone health, hormones. We'll look at everything from pelvic floor to the postural items we talked about, and some of the questions that you're posing in terms of brain health, and everything that affects women. So it's going to be a short but focused series so that people can get real answers. And I think this was a great place to start.
Yeah,
so
great foundation. Thank you so much for having me.
Anytime. Welcome. I'm Robert Brace, founder of Brace Life Studios, and I'm here with Dr. Elizabeth Poynor, gynecological oncologist and surgeon here in New York.
Over the next few episodes, we're tackling something we both see every day. Successful, driven women whose bodies are changing in ways that nobody prepared them for. Loss of strength, shifts in body composition, energy that doesn't respond to what used to work.
Now, the problem isn't effort. It's that most training was never designed for what a woman's body actually needs through these transitions. So in this series, we're going to show you what does work.
So ask yourself, is it your strength, your body composition, or your energy? If any of those hit home, this series is for you.
And if you want to go deeper than watching, Dr. Poynor and I are conducting a formal research study, 12 weeks, medically supervised, and we're only taking 30 women.
Click the link below for the full details and how to apply. We'd love to have you.
Let's get started.